All right, we are back on MorningLine. Thanks for joining us. Talking about the measles outbreak, not in Tennessee. It isn't here yet, but eventually it could make its way here. Already in the Pacific Northwest and in New York City. Our guest with us this morning is Dr. Michelle Fiscus. She's with the Tennessee Health Department, Medical Director, Tennessee Immunization Program. And the bigger picture here that we're talking about, besides this outbreak that hopefully eventually will be contained, is that it's happening because of people not getting the vaccination for it, which you've said is very effective. And, you know, we get other comments here. I mean, there's one said, well, I'm sure you support the Gardasil vaccine, which is MPV, right?
HPV.
HPV. I'm sorry, HPV, yes. And she says it's harming thousands. Where does she get that?
Yeah. So, you know, the internet is full of lots of information, and it's not necessarily credible information. So just, you know, quickly about HPV vaccine. So human papillomavirus is the leading cause of cervical cancer, which kills people. But also importantly, it causes vulvar cancers, anal cancers, head and neck cancers, especially in young men. And it's transmitted through sexual contact, but also just through close contact, intimate touching kind of contact. And not everyone who gets infected with that particular virus will develop cancer, but a lot of people do. And there are tens of thousands of deaths every year related to that virus.
So does that vaccine harm as something? I mean,
the vaccine, you know, like any vaccine, there are always rare instances where there's an allergic reaction or some kind of adverse reaction. But this particular vaccine is nearly 100% effective in preventing human papillomavirus infection and therefore human papillomavirus related cancers.
Okay.
And so if we immunize people before they become sexually active, before they get a chance to contract human papillomavirus, then we can very seriously limit their chance of developing one of those deadly, or if not deadly, then at least debilitating cancers. Women who develop cervical cancer have to have parts of their cervix removed. It can affect their ability to carry a baby in the future. They can infect their partners if they have HPV. So it's a very, very important vaccine. Every child, unless they have some kind of medical contraindication, starting at age 11, needs to get that vaccine and hopefully have that vaccine done within a year of them beginning it.
Okay, yeah, I'm not voiced my belief that vaccines are positive. You know, if someone else saying, well, it's only as an opinion until a family member is injured by a vaccine. And again, I think we can all acknowledge, I'm not saying someone has never had an issue with this, but compared to what you face if you don't, and I can tell you, growing up, my family, my extended family, my son, my wife, everyone, we've all had vaccines and never had a reaction to it. I do know some people that claim to have had some minor allergic reactions. So I believe some of you out there may have had an allergic reaction and then you stay away from it, but it's rare. And when you consider not taking it, these things are preventable, and if you get them, you could die.
Right. Well, and so, you know, a good analogy is seatbelt laws.
Okay.
So there will always be people who will say, well, you know, if I'm in my car and I'm wearing my seatbelt and I go into a river and my car turns upside down, I might have trouble extracting myself because I have my seatbelt on.
Right.
We know that if you don't wear your seatbelt and you're in an automobile accident, your chance of dying in that wreck becomes huge. But that's a choice that affects you and you alone. When we have people who refuse to vaccinate on the schedule, not only does their choice not to vaccinate themselves or their child affect them or their child, but it affects the community around them. It affects people who are going through cancer, who've had bone marrow transplants, who may have a medical condition
whose immune
that stops
system
them.
maybe is compromised.
Exactly. So that, you know, if you don't wear your seatbelt in your car, you may die. If you don't vaccinate yourself or your child, someone else's child may die.
All right.
There's a big difference.
Let's take a call from Paul. Paul, good morning. Hi, Paul.
Hey, good morning, Nick, and good morning to your guest there.
Good morning.
Brother Nick, I don't want to turn this into another topic, and I'm not, because this is a very important topic. But look, people today are so easily fear-mongered and manipulated by stuff that anybody can say, and they'll just take it and run wild with it. A lot of this stuff on the internet that you can look about people getting vaccines, people are saying that it's a thing by the government that makes us guinea pigs, or it's a thing by the government that these vaccinations is used to kill sick people and poor people because we don't want to have to take care of them. I'm serious. Those stories is out there and people believe it's junk, Nick.
Well, that's the problem. The social media and all of that, there's all kinds of stuff. And I don't know what someone's motivation would be to make up something like this to get people maybe not to want to do something. But it does. It's sometimes hard for people to know, well, who do I believe? They're looking at you and they're saying, well, you are a doctor and you are with the state, but, you know, can I really trust her? You know, I read something else on the internet that said this. That's the problem these days. I mean, you are credible, and I vouch for that, and I'm going to believe what you say over some crap I read on the internet.
Yeah, and Paul's point's really well taken, and you know, there is anything on the internet, and if you put in vaccine safety, unfortunately the first several things that come up are going to be mommy blogs and conspiracy theorists who are going to say a lot of things, and they're very scary when you read them. If you don't have a pretty significant depth to your science background, reading those things sound very scary. Very scary.
And they're convincing, they're sometimes well written.
Very much so. And so some of those people are trying to peddle wares, you know, take this vitamin, use this
Right, there's always a motive behind why that. Yeah,
read
you
my
don't need a vaccine, do this. Read my book, eat this, buy this supplement, right?
Some of those people are families who have had children who have autism, who, you know, if my child had a serious medical condition, I would want an answer for that. And so I really empathize with that.
And in the absence of anything else clear, they're saying, what was different about when our child was born? Well, we did give him a vaccine. Maybe that's what led to this. But there's never been a direct causal link that can definitively say that.
That's right. And that's why we don't base medical recommendations on anecdotes.
Right.
That's why we look at tens of thousands or millions of people to look and see, is there more to it than just chance that this could have happened? And what we find when we look at literally millions of children when we've studied vaccines and autism is that there is no greater risk than chance that a child who receives a vaccine would develop autism over a child who does not receive a vaccine.
I want to remind folks, you can call 737-7587, or we're streaming live at newschannel5.com on Facebook if you want to join. And we have some good questions coming in there as well. This woman asks, can a pregnant woman who has been vaccinated but does not have antibodies still, does she need to be concerned for her baby she is carrying? And I'm not sure whether one way or the other, someone who's pregnant in some of these vaccinations and the concern about the child.
So it very much depends on which vaccine and which disease we're talking about. So there are vaccines that women can and should get while they're pregnant. One is the Tdap vaccine, which includes pertussis, and when we vaccinate pregnant women with that vaccine, it actually helps to protect their baby against pertussis, which is whooping cough.
Great.
So that one's very important. Women outside of their first trimester should also receive the flu vaccine, because women who are pregnant are considered to be immune compromised, and so it's more likely that a pregnant woman who contracts flu will die from the flu than someone who is not, and that also helps to protect her baby. So there are a couple of vaccines you should get. There are a few vaccines that you should not get while pregnant, MMR being one of them. OBs will usually check women to make sure that they're immune to rubella, which is one of the components of the MMR vaccine, because there's something called congenital rubella syndrome, where if a woman becomes pregnant and is not immune to rubella and contracts rubella, that can have some serious effects on her baby.
So, and their doctors tell them that in that process. You know, there are some who are those vaccine doubters that say, well, if they're so safe, why is there a vaccine injury fund?
Yeah, so
explain
we can
what
talk
that
a little.
is. Just can you clarify for what that is and why that's there?
Right. So in the 1980s, the federal government actually created a vaccine injury fund, and the reason for that was because so much litigation was happening against vaccine companies for people who were alleging that they had serious adverse events from vaccines, that there was a threat to being able to actually manufacture vaccines. And if we can't manufacture vaccines, then people don't get vaccinated. So the federal government put in place a fund, and so it's a very standardized process. If someone believes that they were directly harmed by a vaccine, they can file a report with Health and Human Services, the federal government. That goes through the Attorney General or the Department of Justice. Those claims are reviewed, and then there's a decision made whether or not there should be compensation made to that family. And so, yes, there have been I think over $1 billion since the 1980s that have been paid out to cases where people have made claims that there have been vaccine injuries. The important thing to understand is that there is no investigation about those cases.
I'm just wondering why they said, is this because then that keeps it out of the courts and the litigation that tied up the money of the pharmaceutical companies to fight this? Because, I mean, if you hear that, you're like, well, and it's true, early on with some of these vaccines, you know, they were injecting stuff sometimes that would make some people sick. I mean, things are much safer now, but years and years ago when they started. But does that not mean, though, that there were some harmed by vaccines?
There's no question that there are some people who suffer adverse reactions from vaccines. There are some people who suffer adverse reactions from vitamin C. There are some people who suffer adverse reactions from sunlight. There are always people who suffer adverse reactions from things. And again, the overwhelming benefit of using the vaccines that are in the schedule really, you know, outshines any risk that's there. Now, if you are the one person who had someone who was truly having an adverse reaction from a vaccine and that caused a long-term problem, then, you know, your chance was 100%. And I completely empathize with that. But to say that the blanket statement that vaccines are not safe or that vaccines are not effective or that vaccines don't prevent disease is just simply untrue.
Right. Okay. So my point being that when I say it's wrong when you make these references about a fund being out there, that it paints the picture that all vaccines are wrong. And we've acknowledged that that some people have reactions, and there have been some settlements that have come out, and there maybe have been mistakes made by pharmaceuticals where they deserve to be held accountable. But your and the medical community's standing is that the vast majority of Americans, and you made the point earlier, Americans in general do. We have a great level of health care in this country. Not everyone, unfortunately, has access to it. But oftentimes when measles gets reintroduced here, because some people weren't vaccinating themselves, it's because someone came from out of the country. Other countries don't have some of the same standards we do, so that means people can come in infected, bring it with them, and then you have a population that for whatever reason chooses not to vaccinate themselves, and then they come into contact and boom, you get a little bloom.
Exactly right. And you know, it's important to note that in Tennessee, we have more than 95% of our kindergartners who have received the entire recommended vaccine schedule. So it's a very small percentage of people who are opting out of vaccines in Tennessee. And the only way to opt out of vaccines in Tennessee, unless you have a true medical exemption, is we do have a religious exemption in Tennessee. But that's a very small number of people. So our rate in Tennessee is one of the highest in the country as far as having our children adequately vaccinated.
And again, is it a requirement now to go to a public school to have the vaccinations?
It is.
It is. I mean, because I recall with my son is we'd get the forms, and the only reason I remember it is my son hates shots, and my wife, you know, usually was the one that would take him because I was at work. But I mean, the requirement is for how many different vaccinations when you go into schools now for kids, public schools?
Yeah. So there's I can't tell you the count off the top of my head, but you know the standard schedule: 2, 4, 6, 9, 12. 18, and then there's a shot at 2, and then the boosters they get at 4 to 6 on kindergarten entry.
And so that's fairly standard, but private schools can go their own way, correct?
They can. So it is up to the school to enforce the recommendations. So you know, we can't require schools to enforce their vaccination standards, but
and I understand religious exemptions as well. You know, I mean, that's going to be there.
Sure, and religious exemptions from organized bodies of religion are extremely unusual. The Catholic Church has come out and said that vaccines should be given. The Jewish community has come out to say that vaccines should be given. So you know, by and large, the larger populations of organized religion in our state and across the country support vaccination.
Yeah.
But it is up to the individual schools to enforce, if they're a private school, what their vaccination policies are. Now, that said, we collect data on that every single year through the Department of Health. We have a very high report rate from schools across the state, and we know that more than 95% of our children entering kindergarten are vaccinated.
All right, we'll take a break. When we come back, other comments coming in on Facebook, and we can take calls as well. Someone's talking about the virus injected is live, and could that spread? And you know, that's a concern. Is it live, and is it active in you, where it can go to someone else or whatever? We'll talk about that, and then take more of your comments as well on Facebook if you'd like, or give us a call, 737-7587, right after this.